no matter what way you present it, these packs were being funded. For right or wrong, they were being funded. And of course there's issues. You know what the issue is? The issue is the fellow who was talking to me this morning, his wife suffering with dementia, they have to pay in January for the blister pack that they were getting free of charge. So don't try to pull this one. The government is actually reducing the cost of medication when people out there have been getting letters from their pharmacies saying from January the 1st, the HSE will no longer be providing blister packs. There will be an additional charge of €20 per month for the packs. Please do not tell people that black is white and white is black. Taoiseach, your decision to restrict medications covered under the phased dispensing scheme operated by pharmacies is a disaster. Your government's decision means that some of the most vulnerable people will no longer receive tablet blister packs free of charge. Now, we're talking about tens of thousands of older people living with conditions such as dementia and Alzheimer's. They rely on tablet blister packs to help manage their medication. We're also talking about people with disabilities who are under real pressure with the cost of living. The packs help them make sure that they take the right dosage and at the right time of day. And your decisions means the cost of dispensing the blister packs, paid for by the state for decades now, will now be passed on to these vulnerable customers. They will be hit by fee charges of up to €50 a month in some cases for these packs. Now, this is a bad decision for the government at any time, but you make this cruel choice during a cost of living crisis when every euro is precious to people. It's like you can't stop yourself from making life harder for people. You hiked up student fees, the local property tax, the cost of petrol and diesel. You stand back and allow big energy companies to jack up electricity and gas bills, and now you hit the most vulnerable elderly people. You're putting huge stress on people during the Christmas period when they know now that they're going to have to face these charges come the 1st of January. Taoiseach, my phone, I'm sure others as well, has been hopping with people very worried and very angry over this. I spoke to one elderly man this morning. He's in his late 70s. He told me that his lovely wife suffers from dementia. He said that without the blister pack, he would find it very hard to manage her medication. But he doesn't know where they're going to find the extra money to pay for them. He says they're literally down to the last euro every couple of weeks as it is. So the explanation that you offer and your government have offered is that the state never agreed to pay for the dispensing of these blister packs in the first place. But do you really think that that matters to people who rely on them? Taoiseach, the fact is the government has been paying for these for decades. If there was a mistake in how the packs were being paid for and a correction had to be made, it should have been made to ensure that those folks could continue receiving their tablet blister packs as they have been. But no, you decided to punish vulnerable people, to ratchet up their costs instead of making sure that they're looked after. And here's the truth, Taoiseach. You had a chance to sort this out. Back in October, when your government was finalising the new community pharmacy agreement, we in Sinn Féin warned you that this was a big mistake to exclude the blister packs. But you chose to ignore that warning, you chose to push on, and now elderly people and others are paying the price. It is not right, it is not fair, and it needs to be stopped. So, Taoiseach, simple questions this morning. On behalf of the man that I was talking to, and I'm sure many, many others right across this state, I want to ask you, do you think it's right that people with dementia and Alzheimer's and other conditions who received their blister packs free of charge up until now will have to pay for them on the 1st of January? And will you now reverse this terrible decision and ensure vulnerable people can continue getting their blister packs free of charge?
In relation to the issue of phased dispensing, and again, we need to look at this, and we will certainly look at any situation where there's potential hardship on any patient or any person in receipt of medicine. But we also have to be clear-eyed as well in terms of, you mentioned pharmacies and so on. I mean, there is an issue between the HSE and pharmacies in respect of the whole area of phased dispensing, which was introduced as far back as 1996 for patient safety reasons, because the supply of medication in instalments can support patients prescribe certain high-risk medications who are at risk of medication misadventure if these medications were supplied monthly. And where a phased dispensing claim is submitted, the current requirement is that an item must be dispensed in the pharmacy across multiple supply occasions. Community pharmacies receive additional payments for phased dispensing. Monitored dosing systems, sometimes referred to as blister packs or compliance aid, are systems that enable the individual medicine doses to be organised according to the prescribed dose schedule. And the HSE's contention is that monitored dosing systems and phased dispensing are two separate processes, and that phased dispensing requires the patient to present to the pharmacy on multiple occasions in the month each week, as it would be unsafe for the patient to have the totality of their medication in one supply occasion. Monitored dosing systems are ordinarily provided in one visit and packaged to indicate when medication should be taken on. The state had never agreed to monitored dosing systems. And that was the context. Sorry, this is the issue. Because, look, invariably you come in another day and question government about how did costs get out of control, how value for money and so on like that. Like, there has to be an engagement between the pharmacy sector and the HSE on these matters. And unfortunately, in the Oireachtas from time to time, you just blow all that out of the water and don't even allow interrogation of the issues. Government will interrogate this again with the HSE and others. But there are issues here that need, I mean, there are agreements between the Irish Pharmacy Union and the department, and we will, and then the National Centre for Pharmaconomics, they carried out an evidence assessment. Just give me the background. You asked a question, which indicated that the evidence was very equivocal in terms of support.
Deputy Doherty.
We will go back and discuss this with the HSE, and during discussions with the Pharmacy Union, it was agreed that improved controls would be introduced.
I asked you the question, and you didn't answer it. I asked you the question with respect, Taoiseach, do you believe that people with dementia and Alzheimer's who were receiving the blister packs free of charge should now be charged for them from the 1st of January? No matter what way you present it, these packs were being funded. For right or wrong, they were being funded. And of course there's issues. You know what the issue is? The issue is the fellow who was talking to me this morning, his wife suffering with dementia, they have to pay in January for the blister pack that they were getting free of charge. So don't try to pull this one. The government is actually reducing the cost of medication when people out there have been getting letters from their pharmacies saying from January the 1st the HSE will no longer be providing blister packs. There will be an additional charge of €20 per month for the packs. Please do not tell people that black is white and white is black.
Pharmacies, I mean, my view is that monitored dosing systems, I'm not so sure there should be a fee attached to them at all, but I'm not so sure either. Hold on. I'm not so sure either the state should be ponying up on everything here. I mean, no, there's no analysis by you of both sides of this engagement. That's my point. And there's too much of that in the House. The easy thing to go for, government must pay for everything, no matter what, how it's presented or how it's manifested. You just cast aside, even though you're a finance spokesman, any sense of controls whatsoever. Or any sense, just let it rip is what your approach. We want to look after people on Alzheimer's and with dementia, and we have in this government. We've done far more in the last number of years for dementia patients than was done in the previous decade or more. That's a fact, and Minister Butler behind me was responsible for a lot of the very proactive work in respect of dementia. But like, where is the rigorous? There needs to be an engagement between the Irish Pharmacy Union and the HSE on this. But it cannot be just the case that every new system or modification of a system or approach is just agreed.
Thank you.
That can't be it either.
Thank you.